The Chinese invented the first natural bristle toothbrush, and it's made from the bristles from pigs' necks. That was in the 15th century. Well, we've come a pretty long way since then when it comes to dental care, and now we know that good dental hygiene should start young. Well, dentist Bridget Remming is here from Tepeyac Community Health Center with tips for parents so they can help kids start and keep those healthy habits. Good morning to you. How are you?
I'm great. Thank you for having me.
Yes, well, brush your teeth is a pretty consistent thing over at my household. We've got the 6-year-old and the 13-year-old. But early childhood carries the most common disease of early childhood. And here's the thing, it's preventable. What is the impact of childhood? What is the impact that childhood carries, and how can we get this done and make sure that we're doing it right?
Sure, yeah. So believe it or not, 1 in every 4 children between the ages of 2 and 5 have already experienced some form of cavity, which is
oh my goodness,
a really big number. And so the impact of that is missing school, missing work, having to take your child to the dentist, and missing work yourself. Those cavities, if left untreated, can turn into pain. That pain can turn into infection, which can lead to unnecessary emergency room visits, which are costly. And really on top of that, it's been shown that children who have poor outcomes with their primary dentition tend to have poor outcomes as adults too.
Got it. So yeah, and that makes a lot of sense. So what exactly causes cavities?
Yeah, so we all have bacteria in our mouth.
Okay.
Same as the gut, there's good bacteria and bad bacteria. That bacteria forms a sticky substance on our teeth called plaque. And when we eat a meal or drink, a sugary substance, the bacteria, the plaque collects that kind of the remnants of that meal, and the bacteria start eating away at that, and they create an acid. The acid burrows a little hole inside your tooth, and that's a cavity. And when that cavity gets through the outer layer, the enamel, it can go into the second and third layer of the tooth, and that's when we start to have pain. Well, first off, we'd start to have like hot-cold sensitivity, but then that can become pain and infection.
Yes, and we do not want pain because the toothaches are definitely the worst thing. Well, what are some of the prevention tools that we have available to us?
Yeah, so fluoride is really the single best preventative tool that we have at our disposal right now as dentists.
Okay.
Fluoride comes in a lot of different forms. It's in your toothpaste, your ADA-approved toothpaste that you use at home. It's in mouth rinses. You could also have it applied topically at the dentist's office. There's varnishes that you can have placed. It's recommended that children have fluoride placed at their dental office about twice a year. If you're high risk for cavities, then you can even have it up to 4 times a year.
Good. Now, is that something we should be asking for as parents, just in case?
Definitely.
Or maybe if we already have a history of dental issues?
Yeah, you can advocate, be your child's advocate, and ask for fluoride to be placed at the dental office. Even medical, some physicians are placing fluoride during well-child checks now too. So it's great collaborative work between medical providers and dental providers.
That is. Okay, here's a question. I've got the 6-year-old, and I've been told that every 6 months is a good dental checkup for her. What is the right age to start taking your kiddo to the dentist?
Well, this might surprise you because the American Academy of Pediatrics and the American Dental Association agree that you should actually visit, your child's first dental visit should be by age 1 or within 6 months of their first tooth erupting. So this is a lot earlier than I think most parents expect, but it's really all about prevention, early detection, establishing that dental home for a child very young so that we don't have the fear and anxiety that comes with sometimes that vulnerability at the dental office.
Yes. That right there is good advice. Okay, walk us through a child's first appointment. What is that like for you?
We like to call them happy visits because they're not so much about getting a lot accomplished. It's more about getting the child comfortable. So letting them hear the sounds, letting them go up and down in the dental chair and, feel what the suction feels like, feel what the air water feels like, and really have the comfort of a parent there by their side and educate the parent as well on what proper home care looks like. So it's not so much about getting a bunch of procedures done the first visit. It's more about just really getting the child comfortable and making sure that we build a great foundation for them to be awesome dental patients for their lives.
That is great. And I think that makes perfect sense. Get them in there early and let them know that it's really not as bad as it seems. Okay, this is a huge question, the pacifier.
Oh, yes.
Why is it important to not have the long-term use of a pacifier?
Yeah, I get it. I have 3 kids of my own, and the struggle is real. The pacifier is, it's a comfort, and kids are naturally, infants naturally are meant to suckle, and that's just their normal response that they learn in the womb. But at some point, the pacifier becomes more of an emotional attachment and less necessary. So usually by the age of 2, we want the child to have the pacifier completely eliminated. If not by 2, definitely by 3, because it can start to affect the growth and development of the child. So if you think about a pacifier sitting inside of a person's mouth during most of their wake and all of their sleep time, it doesn't allow the teeth to actually touch, and it creates an open bite. And our teeth are meant to touch so that we can chew and function properly. We can tear through food. And if a child develops an open bite, the only way to reverse that is through orthodontics. So we don't want to have to pay for that and put our child through that if we can avoid it. So ditch the pacifier if you can. I know it's tough. I'm there with you.
I know. Well, that's good to know, though. Well, thank you so much for being with us today. So much helpful information. You can scan the QR code on your screen to learn more, find a provider, and to be connected to great resources through Tepeyac Community Health Center. And you can also find them at tepeyachealth.org or give them a call. That number is 303-458-5302. Pueden encontrar toda la información sobre la clínica Tepeyac en el sitio tepeyachealth.org.